Hey everyone, welcome to the Health Babes podcast. I'm your host, Dr. Becky Campbell with Dr. Crystal Hone. Today we have Dr. Ruscio on the show talking all about SIBO. He is a naturopathic doctor, a doctor of chiropractic, and he is a clinical researcher. He's really great. We talked all about the symptoms of SIBO, how you treat SIBO, whether you should or should not take probiotics, and a lot more. Everyone, let's welcome Dr. Ruscio to the show. We're so happy to have you. We've been a huge fan of your work for a very long time, and you're kind of an expert on SIBO, among many other things. So we're really excited to talk about that with you today.
Yeah, same here. I always enjoy nerding out on gut health. So looking forward to a fruitful conversation.
Okay, so why don't we talk about how you got into all this? You know, it seems like all functional medicine practitioners have their own health journey. So can you talk us
Yeah.
through yours?
Yeah, myself included. So when I was in college, I was pre-med and thinking about orthopedics. I didn't know it at the time, but ended up contracting an amoeba infection in my intestines, amoeba histolytica specifically, which is a quite pathogenic amoeba. Sometimes the term parasite is thrown around loosely. This is a parasite that kills people in third world countries due to diarrheal dehydration or dysentery. So that was fun. And I went from feeling great, a 22-ish year old, robust health, to insomnia, fatigue, food reactive brain fog that was maybe the worst symptom of just not knowing if I would eat something and then feel tired and foggy for like 3 hours afterward.
Yeah.
A low mood, and did the whole rain dance of saw a few conventional providers, all good people, all tried to help, but none of them really were able to figure out what was going on. Found my way to an alternative provider, and he suggested he thought I had a parasite. I thought he was crazy.
Yeah.
Because I had never left the country. I didn't have your typical, well, I have lots of diarrhea. I went to Mexico on spring break, and then I had really bad diarrhea, and I've had these symptoms ever since. I didn't have any digestive symptoms, which was, uncharacteristic. But in any case, it ended up being that the amoeba was identified on a stool test, and pretty much changed the course of my life from a health trajectory. Started feeling better after I addressed that, and also from the perspective of what I wanted to do, because I saw, geez, if there are other people like me out there who have this web of symptoms and they can't figure out why, if other people are like me and it's coming from their gut, what a cool thing to do in helping people with this. It turns out that was a good bet. And now we're learning a lot of people in the population have GI issues. And so it's pretty much what I eat, live, and breathe.
Yes, absolutely. I'm glad that it sent you down that trajectory, because looking at so much of your research and stuff, I know that you talk a lot about SIBO. And for those that don't know about it, can you kind of explain what that is and just what does it stand for?
Yeah, absolutely. So SIBO stands for Small Intestinal Bacterial Overgrowth. And we should have some intestinal bacteria. Some in the small intestine, much more in the large intestine. We have, as I'm sure your audience probably knows, bacteria in the mouth, bacteria in the lungs, bacteria in the bladder, bacteria on the skin. So we're kind of coated with bacteria, even though it sounds kind of gross.
Yeah.
And they tend to be symbiotic. But in small intestinal bacterial overgrowth, SIBO, there's too much bacteria. And this is where we go from a symbiotic, I scratch your back, you scratch mine relationship, to one that's more detrimental. And part of the reason why SIBO is so important is because the small intestine is where 95% of calories and nutrition are absorbed. It's also where you have the largest density of immune cells in your entire body is in the small intestine. So this is a connection to leaky gut, inflammation, which can be systemic, autoimmune conditions. So if there were one area in the intestinal tract that we really wanted to preserve and optimize the function of, it would be the small intestine. And that's why SIBO and just small intestinal health more broadly so crucially important. And, as a quick aside, the large intestine is 5 feet in length. The small intestine is 22 feet in length. The large intestine absorbs relatively little nutrients and bacteria or nutrients and calories. The small intestine, again, is 95%. So dysfunction in the small intestine can be quite problematic. And the good news is if you fix a dysfunction in the small intestine, like I learned, you can have improvements in quite a wide array of different symptoms.
Oh,
Yeah, for sure. I mean, we see SIBO a lot, in practice, and we see it. Some people have no digestive symptoms at all. I mean, their symptoms are kind of all over the place. So what are the symptoms that you're seeing with SIBO?
Yeah. And there's one thing we should mark, which is up to 22% of people who have a SIBO test positive will have no symptoms. Mm-hmm. So, it's always challenging in terms of interpreting the labs in the context of the individual and kind of getting that balance point right. And I think with the ubiquitous nature now of direct to consumer labs, I think it's important that we have conversations like this to help people not be overly literal in the interpretation, which I know you guys are doing, but I feel like I can never say it enough because we have people coming in who've done all their own labs and they've kind of tied themselves into knots. And it's just important to have some of that context. And I'm sorry, what was the original question? I drifted there. And
that's okay. Just what are the symptoms that you see?
Oh, symptoms. Sorry. Yeah. Kind of like we hit on, the small intestine governs so much. So because of that, we can see both digestive and then also systemic symptoms. So the classical ones would be altered bowel function. Depending on the type of bacteria that overgrow, you could have constipation, you could have diarrhea, you could have both. You could have bloating, pressure, pain, discomfort. You may also have reflux. But then due to the nutrient absorption piece and the leaky gut and inflammation piece, you might have joint pain, skin issues, restless leg, brain fog, insomnia. So I think maybe rather than saying, are these specific symptoms caused by SIBO? Another way we could look at it would be if you have symptoms, there's roughly a 40% chance that SIBO is driving those symptoms. And that's if you look at multiple studies across IBS and brain fog and fatigue, and you kind of average it all out, you get about a 40% likelihood that SIBO could be implicated.
Yeah. And what are you finding is root causes, of SIBO? So especially with relapses.
Yeah, I'm so glad you asked.
Yeah.
Sure. Well, this might be a little bit different than what you hear in some online circles, which I appreciate the perspective of, find your root cause. Mm-hmm. The problem I think with that is it leads people into a very reductionistic, overly pathologized model of thinking about their body. This thing is wrong with me and therefore I have SIBO. And at least my perspective has been a lot of SIBO or IBS or just broadly gut symptoms is wear and tear on the gut.
Yeah.
Maybe you've had a period with too much stress, with not enough sleep. You took antibiotics, and all those things year over year aggregate to an imbalance. Almost like someone who wasn't taking good care of themselves and they're saying, oh, I got this chronic low back pain. Well, how much are you exercising? Do you have good ergonomics? Right? Are you stretching? Are you doing strength training? So I think it's much easier when it's an internal issue to think that there's something kind of seriously wrong. And when it's something like low back pain, we think, oh, it's just a musculoskeletal issue. One thinks of it less pathologically. So I think the best way to frame this is wear and tear on the gut, and these things can totally be remedied. And truly, there are amazing natural tools to repair and rebalance from SIBO. But in terms of causes, there's a couple of sort of hypotheses.
Yeah.
There's a top-down hypothesis, which has been pioneered by Richard McCallum and colleagues. And what they found was oral cavity bacteria, when they sampled the small intestine, were what seemed to be overgrowing in the small intestine. So that's kind of the top mouth down, seeding into the small intestine. And McCallum hypothesizes that this could be due to low stomach acid. So potentially, so that's the sort of top-down hypothesis. If people don't have adequate release of bile and pancreatic enzymes, that's another potential causative factor. Then there's the motility and sort of bottom-up hypothesis, which comes from Mark Pimentel. This is, you've had traveler's diarrhea or a bout of food poisoning, and after this, the motility apparatus in the gut is damaged. Stuff doesn't flow down and sort of out the rectum the way that it should. Things stagnate, foster the overgrowth of bacteria. And then other things like certain drug use, acid-lowering medication, kind of coming back to McCallum's hypothesis, may open the door, non-steroidal anti-inflammatory drugs. And even recently, a meta-analysis found that chronic use of decongestants are at least correlated with dysbiosis. It wasn't SIBO per se, but it was imbalances in the microbiota. And if you think about it, a lot of the decongestants are sympathomimetic. They kind of turn you into the sympathetic state, which helps for breathing, right? But it also puts you in probably too sympathetic of a state, and that may open the door to imbalances in the intestinal bacteria. So there's kind of a number of things, which is why I say I think about it more as wear and tear.
Yeah.
And then what can we do to sort of push your system or support your system back to balance?
Yeah. And it's really too, don't you find, going back a lot to the basics too, right?
Yes.
When it comes to health and simplifying things, because it can just get so overwhelming for patients, and then, sets off their limbic system and stress.
Yes.
And it's just so important. That's such a good point to say that, when it comes to gut.
Yeah. And especially the more educated the person is, a lot of the people that we consult with are very well read, very smart, very proactive. And sometimes we have to pull them back, whoa, it's not as bad as you think. But to your point, right? All that intelligence and all that effort, plus the limbic system, which is naturally geared toward identifying danger, can lead to a really precarious situation.
Yeah.
Do you find that when people come to you and you find SIBO, that they also tend to have infections in the large intestine as well?
No. I'm glad you asked this question also, because as someone that I've looked at probably a little over 2,000 stool tests. I used to order two tandem, stool tests on every individual, plus a SIBO breath test. And I did this for probably 7 years. And the amount of true parasites that I would find on a stool test would be maybe 3 to 5 per year. And then when going to verify those, that dropped off even more. So if anyone would be biased in the direction of parasites, it would be me, because I had one. But they're actually really rare. And we recently did a in-office study where we had 2 different patients pass a bowel movement and put half of their bowel movement in one functional medicine test kit and half of the bowel movement in another. So we split test. And the lack of agreement across the tests was alarming. And I know other people have done the same sort of thing. We'll probably draw this up for publication. So I really think at this point, at least in the area of functional GI care, this doesn't apply to everything. It doesn't apply to thyroid or things like endocrine, but the functional testing, it's probably doing more damage than it is good. And I'll give you one quick example. If someone says, well, we need the test, we need the test data, I get it. And I've been doing that up until about 6 months ago for almost 10 years. But if we consider the fact that far more people will respond to therapies, let's say for SIBO, than actually have SIBO, if we're reserving therapies like a low FODMAP diet or antimicrobial therapy only for those who have a positive test, we're going to miss half the population.
Right.
So my perspective is, with a good healthcare providers' guidance, use the therapies that are safe and natural, and just continue to work through those in sort of the most logical progression. And that's going to get you back to balance, because ultimately what we want is balance in the gut, and usually being devoid of symptoms is the best way to assess that. And I just make that remark because I've seen so many people, for example, let's say they had a stool test 3 years ago, it found candida. They've now been eating low carb that entire time, even though they feel better on carbs. They don't sleep well low carb, their hair is thinning, they're underweight. And it's like, well, how do you feel when you eat fruit, when you eat rice, when you eat potatoes? Oh, I feel great. Well, why aren't you eating them? Well, that's stool test from 3 years ago. And they could only see, if you had done a different functional medicine stool test, it's a 50-50 probability you would have had no fungus on that test. So just, the amount of damage I think we're inadvertently doing, should be discussed. And I think the field, hopefully through a next growth evolution, will really start mitigating the testing in functional GI.
What about for SIBO testing? Because we've seen a lot of unreliable testing for SIBO. I think more than even stool tests, especially because there's different methods, to do it. So what do you even bother doing that? Or do you just kind of know based on speaking, with someone in their history?
Yeah. And, as someone who has published one paper on SIBO, and we have another paper actually under review on SIBO, where we treated half of a group of SIBO patients with antimicrobials and the other half with antimicrobials plus antibiofilm agents, and we did pre-post SIBO breath testing. So as someone who's researched this, I get it, and I've done the testing, but we just stopped doing stool testing and SIBO breath testing just under a year ago because we just weren't getting any benefit. And you know, I think as a clinician, you want to periodically say, is what I'm doing really helpful? And it just felt like everyone was getting a SIBO breath test. Sometimes it was positive, sometimes it was not. We'd still go forward to trying a low FODMAP diet, trying an elemental diet reset, trying probiotics, trying antimicrobials. So it's like, we weren't really changing our treatment much, but we're hurdling the individual with the pre-prep diet, the day of collection, the waiting 2 weeks for the results.
Yeah.
So, and then when we introduce the interpretation guidelines have changed, right? The North American consensus from a few years ago gave us, I think, the best interpretation criteria, but that shifted things from before that. And then there's debate over lactulose testing versus glucose testing. Plus now we have the option of a hydrogen sulfide test. And many, myself included, suspect that that hydrogen sulfide test via TrioSmart probably produces a lot of false negatives. It just, you know, the testing sounds so good. You know, I'm not feeling well, I want to know why, but it's kind of a specious promise that doesn't really tend to bear fruit for people. So I'm with you. I'm really doing little to no GI testing now because of the lack of reliability.
Yeah, we stopped doing SIBO tests like a year or two ago also. Yeah, we were finding a lot of just different, you know, we knew they had SIBO and it was negative, or maybe they didn't have it and it was positive, or there was a time with one company where everybody was positive. And it was just like, ah.
Yeah, and I mean, if there was a treatment that we could only use if someone had that marker positive, then it would make sense. If it was like thyroid hormone, you just can't give people thyroid hormone and say, come back in a month and let's see how you feel, right?
Right.
You need to have evidence of their hormones being low. Okay, that would be justifiable, but so many of the therapies, even the antibiotic rifaximin, it's FDA approved. Not that I'm a huge fan of the FDA per se, but for IBS symptoms.
Yeah.
Yeah. So if you're not doing, just for the listeners, you know, if you're not doing SIBO testing and you're talking about, you're using symptoms and how they feel, kind of walk us through what that looks like for you with how you're managing patients, you know, with SIBO.
Yeah. This is, if we,
and I know it's a loaded question.
Yeah, no, it's a phenomenal question. I think if we could have the functional field take maybe a 6 month to a year moratorium from GI testing, all the clinicians would get better, because you'd really have to listen to the patient. You know, did you try keto? How did that go? Right.
Yeah.
Well, I didn't sleep well. Right. So you get these little things like, okay, maybe this person's too low carb. They're still eating kind of like low carb paleo. And they've also noticed that when they eat too much vegetables, it flares their gut. In fact, a recent study found that the Mediterranean diet, as healthy as that can be, actually made IBS symptoms worse.
Yeah.
So you can get a lot of clues just by saying, well, tell me about what diets you've tried. Tell me about what supplements you've tried. You know, is there, bringing in thyroid for a second, not to go too far afield, but people are sometimes confused about differing opinions they've gotten on their thyroid blood work. For sure. Is there a family history of hypothyroidism? Right? That's going to give you a really helpful indication. Did you go on hormone? And when you did you feel any differently? So there's just so much incredibly important data that we can get from the patient if we listen carefully. And then we use that to generate a hypothesis. Okay, this person, perhaps their gut's not going to do well on a high fiber Mediterranean-like diet. So let's shift them to a low FODMAP diet based upon what they've told us. And maybe they had a response to rifaximin in the past, but to your point, it only lasted for 2 months and then they regressed. And when they did rifaximin, they hadn't changed their diet and they weren't doing any other adjunctive supports like probiotics. So let's use that to say, okay, low FODMAP and probiotics first, reevaluate if that person then needs more symptomatic relief, or if we're not at the target, now we'll consider some sort of antimicrobial or antibiotic. And that, you know, that custom building of a plan that's sort of somewhat linear in fashion, going from the foundations up, so to speak, that tends to really be what helps people have long lasting changes. And it's absolutely in alignment with reduction of the amount of testing that you do, because when you're not treating the lab markers, you're thinking more holistically rather than saying, well, you have SIBO, so now everything is tunnel visioned to SIBO.
Right.
Yeah.
And go ahead, Beck. I didn't mean to cut you off.
No, it's okay. I was just going to ask you, with the diets, the elemental diet, which I want you to kind of explain what that is, but with that and low FODMAP, do you find, because I've heard two sides of this story, and I think that they both make sense. Some people will put their patients on low FODMAP while also doing antimicrobials. And then the other side will say, well, if you do that, the bacteria is not really that easy to kill because it's kind of like hiding with the low FODMAP diet. So what are your thoughts on that?
Yeah. I think, this debate probably goes back maybe like 5 years. I know, exactly what you're referring to. There was that one study that combined guar gum with rifaximin, and they found a slightly better resolution rate, but it was only a really minimal difference, in my opinion, between groups. Some more recent evidence has found that within 2 weeks, a low FODMAP diet can resolve SIBO. And then and this is about by 30%. So 2 weeks on low FODMAP led to a 30% clearance rate of SIBO. If they added Saccharomyces boulardii probiotic to that, it went to 40% clearance rate of SIBO. And that's only in 2 weeks. That's a really short time interval. I get that perspective in terms of feed the bacteria so you kill them faster sort of thing, but I don't think there's really good evidence bearing that out. And also, if we sort of take a meta view and look at some meta-analyses on prebiotic supplementation, so not probiotics, but prebiotics, they're not finding any benefit for IBS symptoms. So, I get where that comes from, but I think because people will sometimes have flaring of their symptoms from a prebiotic, and because that was just one study and it was a minimal benefit, I think we're much better off thinking about low FODMAP with probiotics to start, which one study did find had a better impact than just dietary changes alone. And then if we're not seeing adequate resolution, then we go to either herbal antimicrobial therapy or antibiotic therapy. And just to sort of paint some stats here, because I think the medical research is helpful to get us past opinion, because expert opinion is the lowest form of scientific evidence, right? It's the meta-analyses and the systematic reviews at the top of the pyramid that are, where the gold standard evidence is. So if we look at meta-analysis data, we see that probiotics have about a 50%, roughly, clearance rate for SIBO. Rifaximin, the antibiotic, also about a 50% clearance rate. If we add them together, probiotics with antimicrobials or antibiotics, 85% clearance rate. That's a significant shift. The guar gum, I think, gave like a 3 to 5% increase in clearance. So I think the guar gum or the prebiotic addition is so minimal as to not be novel or worth pursuing. But rather than, let's start with diet and probiotics and then potentially antimicrobial therapy or elemental dieting after that.
Yeah. What is the elemental diet?
The elemental diet is a meal replacement that is meant to be hypoallergenic or formulated to be hypoallergenic, and also prebiotic and fiber free. And why that's helpful is because the elemental diet will absorb within the first 2 to 3 feet of the small intestine, leaving the remaining 19, 20 feet free to rest, to starve the overgrowth, and to repair. And this is why we see with IBS success, and there's really impressive data with inflammatory bowel disease in terms of the ability to reduce leaky gut and inflammation. And we're getting lined up right now to do a randomized trial with the elemental diet versus control, using it in a relaxed fashion, wherein we have people replace about half their calories per day. I borrowed this from the IBD literature, where they were having some IBD cohorts just simply take 1 or 2 shakes as meal replacements per day. And they would do that 6 months, in some cases 2 years, and the outcomes were great in those groups. And so we started doing that with IBS and SIBO individuals, mainly because the one study that looked at this in SIBO had people use the elemental diet exclusively for 2 weeks, which is a really tall order. It's probably overkill. And I think what happened from there was all the practitioners said, well, you got to do it this way. And I don't think they were thinking about the fact that, well, this research study was just at the inception, the researchers said, okay, how are we going to set this up? And once you do it, you commit to it. You can't change the parameters midway through. So it was great, right? It was a landmark study that showed us that, yes, you can reduce SIBO and SIBO symptoms with the elemental diet, but there hasn't been any follow-up research asking the question, might we be able to do this with a more relaxed sort of half and half or hybrid protocol? So I'm excited about that. And we're hopefully going to be enrolling patients sometime early in 2024, because we've seen so many people for whom, if they just, again, simply replace 1 or 2 meals per day with the elemental diet, that period where the small intestine doesn't have the fiber and the probiotics to feed allows the imbalances to be rectified or corrected.
And you have your own elemental diet supplement, right?
We do, because if you go back to the formula that was used in that landmark study, as great as it was, Vivanex Plus, it tastes, if you lick an envelope, the glue on the envelope, that is the taste. I mean, and I can choke a lot down, but even I was like, asking someone to do this for 2 weeks, you're only going to select for the most desperate of people. Sure. And so we did some modifications and got the flavor profile to be, quite a bit more palatable.
That's awesome. We've referred quite a few people to take that, and they like it. Mm-hmm.
Yeah. And I've even found that too. I love the idea of like a modified elemental, and it's so true. A lot of these chronic cases that have come to us too with, people who have been to many practitioners, the type of patients that I'm talking about, the ones that are in constant pain all the time, any type of food flares them, they're usually already doing some sort of a, modified elemental diet. Absolutely. And it works. It really does work. So that's fantastic. That's great.
Yeah. It's almost like intermittent fasting, but without sort of the low calorie stress that intermittent fasting can cause. Because some people do good intermittent fasting, but then some people, typical, they get tired, they get hangry, they don't sleep well.
For sure.
And so this is where you get almost a fasting like effect on the gut without the metabolic sort of, withdrawal.
Yeah. Yeah. So let's get into probiotics. We know the myths, especially with SIBO, that probiotics can make SIBO worse. So let's talk about that, because I know a lot of people are probably thinking about it with all the different information out there.
Yeah. I mean, again, such an important question. We just had someone on one of our YouTube videos, ask, well, so-and-so says you should never use probiotics for SIBO. And this is where we're really trying to help educate people on the fact that expert opinion is the lowest form of scientific evidence. And so if all we have is anecdote, then okay, the experts can sort of debate. But when we have meta-analyses of clinical trials, there really shouldn't be any debate. And that's what we have for probiotics. There have been over 20 clinical trials that have found that probiotics are, as I shared a moment ago, about as effective as antibiotics for SIBO. So, there are still some who, for whatever reason, have a really hard time with probiotics. I think some of this comes from the more conventionally minded providers who they need like the one drug and it makes them uncomfortable that there's lots of different probiotic formulas, which I get, right? But I think the unintended side effect of that or consequence of that is if people are going to not use probiotics when they could see so much benefit from them, we are probably doing more harm than we are good, because there's not probiotics that have like cocaine in them, right? I mean, you want to look for something that's quality, but people aren't dying from non-regulated probiotic supplement use, and people can fairly easily look into companies that follow good manufacturing practices and have things clearly labeled. And also, I mean, if you look at probiotics and then you find one that's so much cheaper, there's a good chance that they're cutting corners there. And by the way, not to go too far afield again, sorry, but if you price out how long it would take to do a probiotic protocol, what you see is some of the sellers on Amazon, and we did this in one of our recent videos, they'll be selling a probiotic for, let's say, $15 a bottle, but you only have a supply that would last you a week if you use a clinically viable dose. Now, another product might cost $40, but that's a 6-week supply. So just be careful, because you have to look at the servings per bottle, not just the sticker price. And that's a trick that some manufacturers are using where, again, you'll have 8 doses And so $15, right? It's cheap. And maybe if you want to assess tolerance, you start with that cheap, $15 bottle one-off, but make sure you look at how many servings you get per unit cost so that you don't find yourself saying 5 days later, like, oh geez, I need to buy another bottle of this probiotic.
Can you talk about your book? Because I know you have a great book, Healthy Gut, Healthy You, right?
Yeah. And sorry, let me take one step back just to probiotics for
Sure.
one more second. One of the things that we're also hoping to publish on next year is if you take a big picture view on probiotics, you see that there's really 3 different types. If you take a meta view, there's lactobacillus and bifidobacterium blends. So you look on the back of the label, lactobacillus, acidophilus, bifidobacterium brevis, let's say. So you'll see 8 to 12 different species of lactobacillus or bifidobacterium. That's one type. There's slight differences across the formulas, but they're really similar. Different to that would be Saccharomyces boulardii. It's actually a fungus.
Yeah.
And you'll see on the back of that Saccharomyces boulardii. And then different to those two are soil-based. And this is usually Bacillus, Streptococcus, or Enterococcus. And why I mention this is it can help people get off the merry-go-round of probiotic formulas. And one of the unfortunate market pressures that I see at current is a company funds a study on their probiotic. It shows benefit, all great, fine, and good. But then there's a lot of incentive to market that specific formula as the formula for constipation, for brain fog, for depression, for cardiovascular health. And what's left out is the fact that there have been direct head-to-head comparison trials comparing different formulas for the same condition and generally showing equivalent result.
Yeah.
So then the way I look at this is, well, if we know Saccharomyces boulardii, it's a fungus, it's different than the lactobacillus and bifidobacterium, it's different than the soil-based probiotic. This is how you can figure out what probiotic protocol is going to be best for you. And what we recommend people do, if they're sensitive, meaning they have a history of supplement reactivity, they start with just one formula. They give it maybe a week, and if it's tolerated, they continue, and they try to work on to all 3, because there is some evidence, although this is early, suggesting that the higher the species count, the more effective the probiotic would be. And ideally, they use all 3 formulas, which is why we have a probiotic called triple therapy, because it's essentially 2 capsules from the one bottle, 2 capsules from the other bottle, 2 capsules from the third in a single serving, hence the triple therapy. But irrespective, just be careful not to use the label or the name as what dictates your experiment. Try the categorical types, find what is tolerable for you, and then usually you'll see a symptomatic improvement within a month. And then some research is showing it may take 2 to 3 months, maybe even a touch longer, to see the full resolution or the full benefit from the protocol, which is important because sometimes people will go on a probiotic, they'll do 1 bottle and conclude, it helped, but it didn't resolve everything. It's like, oh no, don't stop. That's like, you want to keep that and then add one other adjunct support on top of that until you get to a protocol that's really going to get you to 90-ish%.
That's such a good point.
It is. So you're using one type, you're starting them off slowly, and then do you work them up to your triple therapy? I'm just curious what you do.
Yeah. So in those who are sensitive, but that's only in populations that have exhibited a history of being reactive. Right. And then usually what we'll see is 1 or 2 of the formula types don't sit well, but almost everyone can tolerate at least 1 formula. For sure. And so we'll keep them on the 1 or 2, again, for sensitive types that they're able to tolerate. And then usually after a few months, their food tolerance improves. Also, their probiotic tolerance improves. And then we'll pivot them to the triple therapy. And the triple therapy we sell in a single serving stick just to make the dosing easy. And then for people who don't display a history of sensitivity, we just have them start with the triple therapy.
Great.
That's good. Yeah. So the reason I wanted to bring up your book is because you do walk people through really well what to do in the book. And I think that's really great. So can you talk a little bit about it?
Yeah, thank you. The book is entitled Healthy Gut, Healthy You, and it essentially is front loaded with a review of the research on gut health. And then we go into, okay, how do we take all that research and codify that into a series of steps? And there's personalization along the way. but it essentially follows the flow of diet and lifestyle first, probiotics second, elemental diet or antimicrobials third, fiber and prebiotics lastly, and then a reduction of the supplements and an expansion of the diet. And yeah, I know when someone's not feeling well, improving their health can seem like this daunting, challenging
for sure
issue, but it's really we're just taking a deep breath and allowing science to guide us, right? And then that's why I share the stats, because when you're not feeling well, you can read so-and-so say, oh, if you have SIBO, probiotics will flare it and make it worse. And you go, oh, well, I already have brain fog and I don't want to feel it.
There's more.
Yeah. It kind of plays on your emotions. And this is where, data allows us to make objective, intelligent decisions. And so that's what I try to outline in the book. We'll take this one step at a time. We listen to your body. We say your body is boss. Your biofeedback signal is the most important one that we have. And then we continue to work through the steps.
That is so great. Well, this has been an action. This has been such great information for people. They're going to eat this up. Where else can they find you? Because I know you have a podcast and all the things. Yeah,
we have a podcast this year. We've been doing a lot more with YouTube just so we can share sort of visual evidence for all these studies that I've been mentioning throughout the body of the conversation today. So my website is drruscio.com, DRRUSCIO. And then you can plug into our YouTube, our blog, our podcast, the book, our supplement line, our research. We also do offer consulting for people who need some guidance. And like I said, yeah, this is what I eat, live, and breathe. So happy to help people in whatever capacity they would like.
Yes.
Well, thank you so much for coming on. It's been great. And thank you everyone for listening.
We hope you guys enjoyed this episode. If you did, if you can pop over and leave a review, that would be awesome. You can also find us over at healthbabes.com, where you can find our courses, our latest book. We also are on Instagram at The Health Babes, at Dr. Becky Campbell, or at Dr. Crystal Hone. I hope you guys have a great rest of your day.